Up to 10% of the national population currently is affected by chronic kidney failure. But if it is diagnosed and treated early, chronic kidney disease may often be slowed down or stopped. If it keeps getting worse, it may lead to kidney failure. Hence, you need dialysis or a kidney transplant, which is a major challenge nationally.
We have many patients who require transplant but do not have suitable donors. And since we don't take kidneys from dead people, we have inadequate supply. We don't have legislation for rent for us to use organs from other people. And in order to prevent abuse of organs, people harvesting organs in all directions, there has to be legislation and rules governing it. Of course, that one has been presented to the government, specifically to the Ministry of Health, and as of now, their lawyers are working on it.
Davin Nyeri, head of the nursing team of the Renal unit in the country, says that on an average day, Kenyatta National Hospital Renal unit receives around 60 patients. Attesting to her 10 years at the unit, she says that the trend of the disease has been on the rise.
I admit at least 5 patients who are being admitted to the dialysis program per week, and that's a high number. That is only in Kenyatta Hospital. We are eating a lot of junk food. We are eating a lot. We are not eating the original foods that our old fathers used to eat. So this has contributed to the increase of the kidney disease.
Identified as a silent disease, many people do not feel anything until their kidney functions falls up to less than 10%. Many people do not go for medical checkups regularly since, in their own opinion, their bodies are in perfect condition.
Most of the people, if I have hypertension, I will be depending on maybe Panadols, abusing the drugs over the counter. And by the time I come to the hospital to be diagnosed to have kidney disease, it is very late.
So by the time you see us, you have only maybe 1/10 of the size of the kidney or the function of the kidney you're supposed to be having. It is basically a silent killer.
When it reaches its final stages, it becomes even expensive to afford, and many patients die due to lack of treatment. But some hospitals have stepped up to ease the burden of the expenses in the treatment of this disease.
You could find if a patient is in those sites of Nyanza or whatever, they are diagnosed to have a kidney disease. When they are being told to travel, even expenses of traveling alone to Kenyatta Hospital to look for that service was also a problem. So you find that most of them, they die before they reach the centers where they are supposed to be assisted.
We've been able to help at least 5 patients who have been dialyzing in Kenyatta. So they're able to do one in Kenyatta and they're able to come to us and we do one, so that it comes to 2 times or 2 sessions in a week.
As a free medical checkup was being conducted in Nyeri Level 5 Hospital, it was announced that the construction of a renal unit will be done in all major hospitals in the counties to help ease the burden of patients traveling up to Nairobi for treatment for a dialysis procedure. Violet Makendo, GBS News.